Chiropractic care is such an amazing piece of what we do in our office. So we're an integrative health practice. We see patients with thyroid, hormone, digestive issues, fertility issues, but so much of our practice and what we do on a daily basis is chiropractic care. And what a lot of patients don't realize is that chiropractic care is not really just about back pain, headaches, neck pain, although it gets really, really good results for those issues. Really, anyone with any of the issues that I mentioned before would benefit from making sure that you have a healthy nervous system, a healthy brain spinal cord connection to the rest of the body. And so, although chiropractic is associated with back pain, neck pain, headaches, like I had mentioned, what a lot of people don't realize is that chiropractic was actually founded not on pain, but it helped restore the hearing in a janitor in the 1890s. And so it started having nothing to do with back pain, although over time they found that people who got adjusted, who cleared their nervous system, who opened up that healing response, oftentimes had less and less symptoms in all of those areas. And so no matter what you're dealing with, you'd benefit from a healthy nervous system. And I want to go through this chart with you guys. You can see this chart here is showing that communication from the brain to the spinal cord. So the only reason I care about your back or your spine is because it houses the spinal cord inside of it. And that spinal cord is how that brain communicates to the rest of the body. And so you have nerves that come off the top there. That is the most important area in that entire spinal cord, is right up top. That area surrounds the brainstem itself. And so any of those messages that brain is sending down or receiving up from the rest of the body has to go through that area. And so it's really critical that that area is communicating as efficiently as possible. Some of the symptoms patients might notice if there's an issue in that area: headaches, migraines, sinus issues, allergies, hormonal issues, digestive issues. All of those can be affected by that. And so if you scroll down just a little bit here, you can see that the thyroid is a piece that's often involved. Around C7, that's a really important area. As you go down farther, T1 to T4 is an incredibly important area in regards to heart and lungs. As you go down, digestive issues, hormone issues, all of that is communicated. It's critical that that communication is open as much as we possibly can to speed up and optimize that healing process. So you may be taking the best herbs, eating the best food on the planet, and if your nervous system is not communicating effectively to the stomach, you're not going to be digesting and absorbing those nutrients as effectively as possible. And so again, regardless of what your symptom or condition is, our goal is to optimize that healing response. And like I had mentioned, everybody can benefit. So you do have nerves that go to all of the muscles you have nerves that go to all the muscles in the body as well. And so those muscles along the spine, if those are imbalanced, oftentimes that's where you'd notice pain and symptoms as well. And so a lot of people ask, well, how do I get that? How does that even happen? And there's three different things that can cause an interference there. So physical stress, which we all think of in regards to a car accident or an injury or a fall, those are all physical stressors that can cause an imbalance in that system. Number two is chemical stress. So the foods that we eat, the toxins that we put on our body, the air that we breathe, all of these are toxic issues. Even medications, although there's a time and place, all of those can be toxic to the body as well. And so our goal with our care is to get the body to such a level of health that under the supervision of your doctor, you're able to go off your medications or dramatically reduce them. Again, I don't tell you to do all that right away. I never tell you to do that without being supervised by a medical doctor in regards to that, but we have had hundreds and hundreds of patients be able to go off medications under the supervision because we build so much health into the body that there's very little, if any, need to continue on that. But again, those are a toxicity to the body. And the last one, probably the most common one that gets overlooked, is emotional stress. So we are more stressed today, I would argue, than we've been in decades, maybe in our entire lifetimes for people living right now. And so your body hears what your mind is telling it. And so the amount of stress that we put under our body, that also can take that nervous system from healing mode, or what's called parasympathetic dominance, and puts it into the fight or flight response. And so although that fight or flight response is excellent in times of major stress, it helps us adapt. For example, if you were being chased by a tiger, you would want your body to go in that fight or flight response. And respond appropriately. The blood would go from the gut to the extremities. It would help you run. It would help you survive. But the goal is, after that, we would want the body to go back into that parasympathetic state and relax, repair, heal, digest. And so, since there's such a chronic problem with physical, chemical, and emotional stress, and we're exposed to those on a daily basis, it is really critical that the body is able to go back into the adaptive state, because that's really where that true healing takes place. And so we have technology in our office that allows us to scan that spinal cord. We're able to see where the interference is, how significant, how severe that imbalance is. And with that information, we can put together the best plan and approach in your specific case to restore that healing back into the body. And when you do that, that's when absolutely amazing things happen. So, like I mentioned, the first chiropractic adjustment, a deaf janitor's hearing was restored. The second adjustment, it was a man with heart disease, and his heart started to improve function. So it's amazing stuff. I have seen so many absolutely amazing changes in the body, and so I'd love to help you if that's something you're looking into. We don't do any twisting, turning, popping, snapping. It's all neurologically based. I see babies right after birth, all the way up to elderly athletes, people just wanting to optimize their healing response in between. So if there's anything I can do to help you, please give our office a call. I would love to see if there's anything I can do to help, and I'd love to bring you into our office family and help you get the results that you've always been looking for. Take care.